Today we are answering the question, how to find someone to help my parent in their home. Part 2 of the answer is the type of assistance your parent needs and the payment source. Question and answer opportunities come to you in Care Coach Insider News. You can subscribe at endlesslegacy.com. I am Rhonda Caudill, Elderly Parent Care Coach and Geriatric Care Manager. I am glad you are a follower, especially if you are caring for an elder parent and are able to get your burning question answered through Ask the Expert. Basically, the type of assistance your parent may need in their home could be in two categories: medical and non-medical. Medical help is usually performed by a professional licensed medical provider, such as a registered nurse or LPN, a physical therapist, an occupational therapist, respiratory therapist, or a speech therapist. These providers are also commonly referred to as skilled care providers. Non-medical help is usually performed by a non-skilled provider. Even though you and I know it takes skills to perform these tasks, and many of these people are also what I call professionals. But for clarity's sake, we will keep with the common vernacular. Non-medical providers are certified nursing assistants, CNA, or companion or sitter. The non-skilled care is more diverse, described as ADL and IADL. Okay, enough with abbreviations. Activities of daily living and instrumental activities of daily living. Some examples: eating, dressing, bathing, walking, making transfers from bed to chair, toileting. IADLs could be managing finances, handling transportation, whether it's driving or public, shopping, preparing meals, using the telephone and other communication devices, managing medications, housework, and basic home maintenance. In-home medical or skilled care services are usually called home health services. In-home non-skilled care is referred to as home care services. So many agencies provide one or the other, but some do provide both. The payment source is going to depend on whether it's home health or home care, and is really all in the fine print. So most people are paying privately out of their senior's pocket or out of the family member's pocket. Medicare may partially pay depending on the reason for the care, the type of care, a doctor's order, and what precipitated the need for care. The care is usually limited to a certain number of days and other conditions. So you really need to see Medicare.gov for more details. Then people who have Medicare supplemental insurance depends on the policy source and the policy language. That's the fine print. The same with a long-term care insurance policy. It all depends on the policy benefit language and the conditions. Under Medicaid, this is a federal, strictly financial need-based program with additional state benefits and limits, which may be different in every state. So some states have a community in-home service benefit and some do not. Again, you would need to check with the Medicaid office website in your state. Watch for Part 3, Options of Providers for My Parents' Care in-home, at next month's Care Coach Insider News. If you are gaining valuable information from our newsletter, please email it to a friend or anyone you know who has questions about elder parent care, or let them know they can go to endlesslegacy.com and sign up for the newsletter there. Thanks for caring for your parents and for educating yourself in the process. I will see you next month.